Hello, everyone. My name is Clark Evans. Today I will be talking to you all about Haiti and Louisiana and how their global health systems compare and contrast with each other. Haiti is a country located in the Caribbean Sea that includes the western third of the island Hispaniola. The capital of Haiti is Port-au-Prince. Haiti's population is made up of entirely almost all African slave descendants who won their independence from France in 1804, making it the very second country in the Americas after the United States to free itself from colonial rule. Over the centuries, however, economic, political, and social difficulties, as well as a number of natural disasters, such as earthquakes, have beset Haiti with chronic poverty and other serious problems that have led to a poor state of health for the country of Haiti. With its geographic location being in such close proximity to Louisiana, it is no wonder why Haiti and Louisiana have such a common shared history. Between Creole, Voodoo, and even Carnival, Louisiana and Haiti have a lot in common. The transatlantic slave trade, as well as French possession of Louisiana and Louisiana Purchase, has a lot to do with why Louisiana and Haiti are so similar and why the people are so similar as well, even down to the cuisine. Today I'm going to analyze a few health and social factors that may contribute to why things are the way they are in each place, and I'm going to demonstrate how they are so similar and ways in which they are different. I'm going to talk about the maternal and child health, the mortality rates, the rates of chronic diseases, the rates of infectious diseases, the education, the diets and cuisines, the healthcare systems, physicians and hospitals, the religious influence, and the socio-economic factors that play a role in the health of each place. In Haiti, it is approximated that 1 in every 80 women will die from childbirth or pregnancy-related causes. One of the major problems is that there's a lack in continuity of care, a severe shortage on healthcare providers, and a lot of times when women come in to be seen, the doctors are unaware of any pre-existing health conditions that may affect them as soon as they walk in the door, such as HIV or even preeclampsia. 10% of all of the maternal deaths are AIDS related. About 55 out of every 1,000 live births, the infant will die. There's very limited intensive care and there's virtually no neonatal care. The primary causes of maternal mortality are hypertension, which is 26%, postpartum hemorrhaging, which is 23%, 20% die of indirect causes, which includes the 10% for HIV, and the other 10% are diseases such as malaria or cardiac disease. 11% die because of infection, and 10% die due to unsafe abortions. In Louisiana, the maternal mortality rates are not nearly as high as they are in Haiti. However, they are well above the national average. Approximately 12.4 out of every 100,000 births, a woman will die in childbirth here in Louisiana. 12.3% of births in Louisiana are preterm, compared to 18% of births being preterm in Haiti, and that number is disproportionately higher amongst African American women compared to other races of women such as Caucasian or Hispanic or even Asian. There's still research that needs to be done into trying to remediate that issue and why it is so prevalent among African American women, not only living in poverty, but African American women who are middle and upper class still experiencing preterm birth and birth issues. In Haiti, the average life expectancy for a male is 61.3 years old, and the average life expectancy for a female is 65.7 years old. That is a ranking of 154 according to the World Health Organization. The top 5 causes of death in Haiti are coronary heart disease, stroke, the flu or pneumonia, diabetes, and HIV/AIDS. In Louisiana, the average life expectancy for males is 72.75 years old. The average life expectancy for females is 78.64 years old, and that is below the national average of 76 for men and 81 for females. The top 5 causes of death in Louisiana are heart disease, cancer, accidents, lung disease, and stroke. According to the World Health Organization as well as the CDC, 3 out of the top 5 causes of death in Haiti are non-communicable or chronic diseases. This number is becoming increasingly prevalent among women in low-income countries such as Haiti. A lot of people think that this is due to lack of education on what you should and shouldn't eat, as well as lack of education on the dangers of tobacco and other drugs such as tobacco that have long-term health effects. Chronic disease in Louisiana is extremely prevalent. 3 out of the top 5 causes of death in Louisiana are related to chronic diseases. The projected cost from the year 2016 to 2030 in Louisiana of chronic disease is $612 billion. In 2015, 2.9 million people in Louisiana had at least one chronic disease, and 1.2 million had 2 or more chronic diseases. Chronic disease could cost Louisiana $28 billion in medical costs and an extra $12 billion in annually lost employee productivity between 2016 and 2030. Many chronic diseases in Louisiana are preventable. However, 68% of adults in Louisiana are overweight or obese. 48% eat less than 1 fruit a day. 33% eat less than 1 vegetable a day, and 27% of adults in Louisiana smoke cigarettes. One of the leading causes of death in Haiti are infectious diseases, and particularly HIV, as one of the top 5 leading causes of death in Haiti. In addition to HIV, cholera, TB, typhoid, malaria, meningitis also run extremely rampant throughout Haiti. In fact, Haiti has the highest incidence of tuberculosis in the Western Hemisphere. Also, Haiti has an extremely high incidence of multi-drug resistant TB as well. In 2011, there was a cholera outbreak and as of 2019, there were at least 900 reported cases of cholera in Haiti. Since 2012, incidence has decreased about 99%. Malaria is also a leading cause of death in Haiti, as well as many other neglected tropical diseases. A lot of people attribute this to the earthquake that took place. People had to live in very close confined spaces, and they became susceptible to many infectious and waterborne diseases. This is due to issues with sanitation and sitting water. Many people do not have access to clean water, and that assists in the spread of many infectious diseases that lead to death or illness. In Louisiana, infectious diseases are not nearly as prevalent as they are in Haiti. However, Louisiana is home to 2 of the highest ranked cities for HIV and AIDS, Baton Rouge, Louisiana, as well as New Orleans, Louisiana. As of 2018, there have been many cases of chlamydia, pertussis, which is whooping cough, and salmonella, which is generally a foodborne illness, in Louisiana. Children and older adults are at the highest risk of these diseases, and also racial and ethnic minorities are at the highest risk as well. One of the ways to help this are immunization, childhood vaccine programs, and funding. In Haiti, children are only required by law to attend school through elementary school. High school is not required by law, and the average literacy rate for children ages 15 to 24 years old for males is 70%, and for females is 70% as well. However, the average secondary school participation for males is 20%, and for females is 19%. One thing that Louisiana and Haiti both have in common are good, tasty, well-seasoned, and flavorful foods. Common foods that are eaten in both places are beans and rice, chicken, pork, and really just fried foods in general are very common in both places. And jambalayas, soups. The cuisine kind of mirrors each other, and you can see that Haitian influence in Louisiana Creole food. However, one thing that they also have in common is increasing obesity rates. In Haiti, 26.9% of females are obese and 17.9% of males are obese. However, obesity is even more prevalent in Louisiana. as Louisiana is ranked number 6 out of the 50 states for obesity, and that number is steadily increasing. While 36% of adults in Louisiana are obese, mainly between the ages of 45 and 64, 46% of all obese adults are African Americans. I have personal experience with the Haitian healthcare system. The healthcare system in Haiti is not the greatest. Most people have very limited access to medical care and physicians, and the amount of physicians in Haiti is 25 per 100,000 and 11 nurses and midwives per 100,000 people. With Haiti having a population of a little over 10 million, that's not enough. Most people in Haiti don't even go to the doctors regularly, and they wait until a situation is extremely dire before they go to seek treatment. The insurance system in Haiti is pretty much non existent. Very few people have medical insurance because very few people can afford it. Most people, if you don't have insurance and you can't afford to pay out of pocket, you don't get treated no matter how bad the situation is. Even if you're dying, potentially you could be left on the hospital steps to die in Haiti. That's just the way things are. While a lot of charity groups and not-for-profit organizations are working to try and remediate that, it's still a very, very, very prevalent issue in Haiti. And then there's the issue of people relying on traditional and religious forms of treatment rather than seeking a doctor for serious conditions. In Louisiana, the healthcare system is a little different. Currently, due to Medicaid, about 1.5 million people are currently on Medicaid in Louisiana, and it has reduced the amount of people who are uninsured in Louisiana by 50%. More and more people are getting insurance, especially thanks to the Affordable Health Care Act, and that has definitely helped the healthcare system in Louisiana. While the Medicaid expansion has definitely and dramatically helped the healthcare system in Louisiana is still ranked among the lowest of healthcare systems in the United States. Obesity, poverty, and smoking are just a few of those reasons. While the cost of insurance are increasingly high for those who can afford it, a lot of people do not have access to healthcare, especially those living in rural areas, and Louisiana is definitely a place that has many, many rural areas because it is one of the poorest states in the United States of America. In Haiti, voodoo is an extremely common and misunderstood practice. A lot of people in Haiti practice voodoo as well as Christianity, such as Catholicism and Protestant religions. However, many people have misunderstood voodoo to be some type of witchcraft, when it really is just life practices. Sometimes people rely on voodoo treatments and rituals to take care of healthcare problems that would require them to go to a physician. They'd rather just go to the local voodoo priestess or priest. That becomes a problem because by the time a person realizes that they need to go to the doctor in Haiti, normally it's too late. In Louisiana, voodoo is prevalent in some areas. However, people still are more likely to seek real medical care when a situation is dire. In Louisiana, there are some remnants of voodoo practices because sometimes people decide to use natural healing methods that have been passed down through generations that have roots in places such as Haiti and Africa. Haiti is an extremely poor country. Their GNI per capita is about $1,700. About 46% of the population lives in rural area, and about 59% of the population is in poverty. 94% of the Haitian population is black, about 5% is mulatto, and about 1% is other. The mulatto population tends to be a part of the 1%, or the Haitian elite. There are people in Haiti who make significantly more than the GNI per capita. Those people tend to be mulatto, which means they're more closely descended from the France who occupied Haiti over 200 years ago. The black population in Haiti, which are directly descended from African slaves, tend to be the poorest in the country, and they are referred to as the paysan class, which simply means peasants. You can see a correlation between poverty and health directly in Louisiana, but in a different way, as there is a more vast variety of races of people in Louisiana than there is in Haiti. In Haiti, generally, it is a fully black population for the most part, so you have to take that into account when comparing the two places. However, you can see in both cases there is a direct link between health and poverty. Thank you so much for taking the time to watch this video. If you have any questions, please feel free to email me. I hope that you were able to learn something, and I hope that it will inspire you to do more research. Au revoir!